idea was this small, I call it pilot study, was to see, how it will perform in patients who have perfect vision, which are the patients for refractive lens exchange. And in my hospital, in my setting, this is a fairly large part of the patients I operate them. And so if you can go to the next slide. The idea was to compare it with a very well-established lens, and we've been using the Acrysof Vivity intraocular lens for the last, well, at least 6 years, and I was also part of a multi-center study. It actually works very well for us, and I've done over 1,500 refractive lens exchanges with a blended vision concept, similar to Press Beyond, where we correct one eye for distance, which will give you a distance intermediate vision, and the fellow eye would be corrected slightly for myopia of about minus 0.75 diopters, delivering intermediate vision and near vision. So this is how we work. But as you know, the Acrysof Vivity works as entirely different optical paths and a different concept. So the idea was there just to see, how those two different concepts, as was just shown by Pablo, and the one, from Alcon compare in refractive patients. So the next slide, please. So what we did, we decided just to compare it with a Vivity lens, and just for you to know, we already did a small study where we checked the blended vision concept and presented in 2022 on 30 patients, basically actually showing very good results with Vivity. And obviously the question was here, is ArtIOL going to perform at least as good, or perhaps better than the lens that everybody knows? Next slide, please. So we can jump over, because Pablo already explained the concept. And next slide. Okay, I think it's important, although Pablo mentioned it, because the idea was to get a full range of vision. And we always talk about binocular vision, because if you do like mini monovision, blended vision, we're talking about binocular vision. So we're going not to talk about single eyes, but a binocular vision. And this is a study that was published by Dr. Marini Jerez 2 years ago. But these, again, were cataract patients. And obviously, cataract patients are always happy because they see better, because they get rid of the cataract. Whereas refractive lens exchange, the patients are more demanding and they really expect freedom of glasses. Next slide, please. So, these are the two different lenses. Everything been explained. The patients included had to have a best corrected visual acuity of 0.8, which is 20/25 at least, or better. The vast majority of them had 1.0, which is 20/20 or better, with some even 1.25. No other obviously ocular pathology. We had to choose patients with astigmatism less than 1 diopter, because the ArtIOL as available to us did not have the toric component. So we had to correct the astigmatism if it was any astigmatism by incision. And, we check every single patient before we apply the blended vision a blended vision concept. We do, which we call a Press Beyond test. The test that's been developed by Dan Reinstein and his group, as we use for laser refractive surgery. And we follow up for at least 3 months. And we had 20 eyes in each group. Next slide, please. Okay, so 10 patients were implanted with the Acrysof Vivity. The distant eye was, ended up basically being more or less almost zero, minus 0.12 diopters. And we call it a reading eye. It does not always have to be a non-dominant eye. Sometimes there's enough patients who have a cross-fixation. The reading eye was roughly around minus 1 diopter. For the ArtIOL group, the distant eye received the ArtIOL 40, which has a lower spherical aberration as the 70, and we ended up being just slightly a little bit more myopic compared to Acrysof, around minus 0.25. Again, with the reading eye around minus 0.56, but the reading eye would have the ArtIOL 70, which by itself has a more depth of focus as compared to the ArtIOL 40. When you look at the implanted power, there's no big differences. Okay, it's 22 diopters in Vivity, it's 23.5 in ArtIOL, all identical age, typical age for refractive lens exchange. And what's important is I never, ever do refractive lens exchange for myopic patients, full stop. So what you see here are hyperopic patients, usually low hyperops, a few emetrops, but in the majority, we're talking about refractive lens exchange in hyperopic patients with low astigmatism. Next slide, please. And here are the results. Okay, so first, let's talk about the post-operative refractive and binocular uncorrected visual acuity, because this is what these patients or clients are aiming for. And this is why we chose a 2020 uncorrected and a 2025 uncorrected. Why 2020? Well, this is sort of the best target, more or less possible, and 2025 gives you a good everyday's vision, even if you cannot reach 2020. So the 2020 ArtIOLs was just slightly better at all distances, far, interim distance and near, whereas for 2025 was more or less the same. Still, it was not statistically significant. Next slide, please. When we look at the entire range of corrected versus uncorrected vision, again, on your left-hand side, you see the ArtIOL best corrected compared to Vivity best corrected, and the results are quite similar, although, again, in 2020 group, the ArtIOL did perform better. In terms of uncorrected visual acuity, and again, this is what we really were aiming for, both lenses performed quite good. And the next slide will show you the only important difference between the two lenses, and was the uncorrected near visual acuity. Although, as you can see, in terms of spherical equivalent, Vivity in the reading eye was always set at around -1, where you would expect a better near vision. Still, ArtIOL 70, which was chosen for the near eye, performed better. And this is where I put this little arrow. So it was more reminiscent of the trifocal lens in terms of a defocus. Okay. Next slide, please. And it was statistically significant. This was the only statistically significant point. And, as usual, we also ask the patients about their satisfaction. And there's a questionnaire, the CATQuest questionnaire, which is, used in a variety of studies. Important tasks like, reading newspaper, face recognition. And you see more or less the same, with better results for face recognition for the ArtIOL. But in general, both groups were happy with the results achieved. So next slide, please. So what is the conclusion? Again, it's a pilot study. It's not a large-scale study. It's a pilot study. But at least we can say that both intraocular lenses, when applying the concept of blended vision in hyperopic refractive lens exchange, really achieved a high satisfaction rate. Both intraocular lenses provide a good to excellent binocular unaided vision at all distances when used as a blended vision. And what we could see that the ART 40 in the dominant eye, ART 70 in the reading eye combination achieved a better uncorrected near visual acuity, which was 1.25 versus 0.8 decimal, and which was the only significance. So I think, when you look at a new lens entering the market, I think it's worth to compare it to the lens that's been, sold for over 1 million times, and say, okay, it's at least as good and perhaps even better. And obviously for the other things, like Pablo mentioned, this photopsis, whatever, we did not have any problems in any of the groups, but the groups were too small. I mean, when you look for this photopsis, obviously it's not enough to have 20 patients. You've got to have whatever, 1,000 patients, then we could make statistics. Thank you very much.